Welcome. I'm now covering systemic activation of hemostasis, extensive activation all over the body. The major condition is DIC, Disseminated Intravascular Coagulation, but also TTP and HUS briefly. What is DIC? Systemic activation of coagulation and consumption of all coagulation factors and platelets results in severe bleeding. So, some stimulus for the activation of coagulation leading to activation of coagulation, forming those micro thrombi and breakdown of the thrombi by fibrinolysis, ultimately using up of all the coagulation factors and platelets results in severe bleeding. So, thrombosis, bleeding, loss of factors. Common causes are the infections extensive, trauma, cancer. In all this, there is release of tissue factor into the circulation or widespread endothelial damage leading to activation, and activation of fibrinolysis leading to excess fibrin breakdown products. So clinically, extensive thrombosis, severe bleeding, shock, renal failure, organ failure, and laboratory tests, all tests abnormal because everything gets used up. So just note that DIC is not a simple disease. It's a life-threatening, extensive bleeding, severe, all types, both superficial and deep, and increased fibrin degradation products because there is extensive breakdown of thrombi, the FDP, and D-dimer is also a breakdown product of fibrin, and both of them will be raised. So I'm just summarizing: massive tissue destruction, any traumas, infections, or extensive endothelial injuries, viral infections, release tissue factor, widespread microvascular thrombosis, leading to ischemic tissue damage, consumption of coagulation factors, ultimately leading to extensive bleeding, and also fibrinolysis. All this together leads to decreased platelets and increased PT, PTT, thrombin time, all abnormal, and increased fibrin degradation products and D-dimer. Okay. Now briefly, what is thrombotic thrombocytopenic purpura, TTP, and HUS, hemolytic uremic syndrome? They are almost like DIC, widespread thrombosis in the microcirculation, organ infarctions, microangiopathic hemolytic anemia, that is breakdown of the RBC due to formation of the fibrin threads. Okay, so these features are also seen in DIC, but unlike DIC, coagulation factors usually remain normal. So there is only activation of platelets, very little activation of coagulation. Okay, these conditions are similar to DIC, but slight difference. The two major, thrombotic thrombocytopenic purpura, more common in adults, hemolytic uremic syndrome, more common in children. So TTP, widespread thrombosis with neurological deficits, the thrombi in the brain causing stroke, kidney failure, but predominantly neurological deficits is TTP, predominantly kidney failure is HUS. Okay. Now there are two types. All of them are due to deficiency of an enzyme ADAMTS13, a protease which normally breaks down 1 millibrand factor multimers after the formation of thrombus to stop further activation. So remember, TTP is something like opposite of 1 millibrands, excess 1 millibrand factor. The deficiency of this enzyme can be acquired, more common in autoimmune disorders, or congenital due to mutations. Plasma exchange to remove excess 1 millibrand factor is now saving lives. Extensive widespread thrombus formation within the capillaries. Hemolytic uremic syndrome is similar to TTP, but kidney failure is the major disorder. More common in children, toxic endothelial damage leading to thrombosis, The childhood HUS, the enzyme levels will be normal. So it is not like TTP. It is more due to infections and the Shiga toxin causing the extensive endothelial damage, activating only platelets, not much of coagulation. Whereas adult HUS, it is nothing but TTP with predominant renal failure. So in summary, we discussed DIC, activation of both platelets and coagulation, more common, and then TTP, activation of only platelets with the neurological deficits, HUS with renal failure. Okay, thank you.